I'm Joaquin Beltran. I'm the creator of Speak Up America. I'm here with my friend Jeremy, who's an expert in virology.
I'm Jeremy Rossman. I'm the president of the nonprofit organization Research-Aid Networks and an honorary senior lecturer in virology at the University of Kent in England. And it's great to be here and chat with you about coronaviruses.
Yeah, it's great to be here with you too, Jeremy. So just to share with other people who are going to come across this, we both met through our volunteer work with endcoronavirus.org, along with a lot of other people who are doing amazing things to combat COVID-19. And we were talking about how it's important to share as much information as we can with people about where COVID-19 is found and how to get there. So we're just going to have a conversation about this and lean on Jeremy's expertise to help dive into these questions. So yeah, let's get into it, Jeremy. Where is COVID-19 found? How did it get there?
So if you're infected, it's in your respiratory tract. And so this means your nose, your throat, your lungs. So if you're infected, you're breathing it out, you're coughing, you're sneezing, even just you talking. All of that is just putting this virus out into the environment.
And so out into the environment. So what environment? Like, where does this go? Where does the virus go?
So so say I'm infected and, I've got some virus in my nose. All right. Well, if we're sitting at the bar and I go wipe my nose like this and I go grab, the beer glass, well, then I might have just transferred the virus from my nose to my hand to the beer glass. So, all right. So
you're making me miss being at bars right now, Jeremy.
I know. You can tell where my mind's going right now.
Okay. All right. So you touch the beer glass and okay.
So that's one way. And that could be anything. It could have, been a coffee cup, I guess. I'd rather have it be a beer glass. But, you're touching something. And so you're transferring the virus from, say your nose to that surface. But, it's also in your respiratory tract. And so this means that every time you're breathing, every time you're coughing, sneezing, talking, the virus is coming out. And so, the virus doesn't just come out and hang out in the air for forever. It's in these, you've heard about respiratory droplets a lot, right?
Right, definitely.
Yeah. So all this is just that, the virus that's in your nose or your throat or your lungs, it's not just hanging out in the air. It's in this, mucus and snot and other fun stuff. And so as you're breathing, it's coming out in these little droplets. And these droplets are kind of heavy. It's like a sort of car going off the cliff. They're not going and just hanging out in the air. So, we're sitting at the bar and I'm talking and, right now, the virus that's coming out of my mouth isn't just hanging around for hours and hours and hours. It's sort of traveling a little bit and then it's heading down to the ground, or if I'm talking over my beer glass, it could be heading over to there, or the table, or whatever is in front of me, or, even my hand, if, that's where I'm talking. It's just coming out of you and it's settling down from the air.
And so for other people who are around, an infected person who, is breathing and their respiratory droplets are being released and it's infecting the surfaces around them, how do the other people around this person or in this environment get COVID-19?
Yeah. So, all right. So, I'll invite you out to the bar. We're both sitting at the bar now. And, I've just touched my nose and I've then touched the beer glass, and you're being very generous and you go up and you take both of our beer glasses up to the counter to go get another round. Well, now you've just touched my beer glass. So that means you've touched the virus that was on that glass. So now you have virus on your hand. Now, you having virus on your hand doesn't really do anything to you. It's not getting through your skin. It's not going to do anything like that. But if you have that virus on your hand and then you put that beer glass down on the table and then your nose itches, and so you go like that,
Right, right.
Well, all of a sudden you've just given yourself COVID-19. So
Yikes.
it's that's the first way, is that, if you're touching any of these contaminated objects or surfaces, I mean, a door handle, a glass, a table, it could be anything, then touching your face, that's one way that you can get it.
Right. And so if we're hanging out too, and you hear that people are carriers while they're asymptomatic, right? Right. And so we're hanging out, and you seem totally healthy, right? How is it that I still am getting the virus?
Yeah, that's one of the most difficult to combat aspects of COVID-19, is that so many people spread the virus before they really start getting sick. Because, if we're going out to the bar and I'm ill, or been tested and have COVID-19, well, then I should be staying at home, and that's really easy. But if things are open and you're going out and you feel perfectly fine, some people actually, unfortunately, a lot of people actually spread the virus very well before they start showing symptoms. So it's a real problem, because both anything that somebody that's infected is touching, or just the air that they're breathing out, all of this can be contaminated before somebody even realizes that they're sick. So, what do you do about that? It's a difficult thing. So, I mean, the simplest thing is that, this is why people are recommending everybody wears face coverings when
Mm,
you're out, because that's the first and simplest thing that, I could do to make sure that you don't get infected. Is if I'm wearing a face covering, then, say I do have COVID-19, but I don't have symptoms yet. All
right.
right. Well, I might still be breathing out these respiratory droplets. But if I have this face covering on, then that's helping to stop these droplets from getting out and getting into the air or dropping onto a table. And so that's helping to protect you. So if I go and I wear that, that's protecting you. But also, if I'm going out and making sure that I'm not touching my face, so I'm not transferring the virus from my face to the beer glass, or if I, sneeze, I make sure I wash my hands afterwards. So face coverings, washing your hands, not touching your face, all of that will help protect you.
Mm. So it sounds like it goes both ways, right? If someone's sick, right, but they don't know they're sick, it's good for them to wash their hands too, in order to prevent sharing that, right? And also for people to avoid getting it, right?
Exactly. It goes both directions, and it's really similar actions, because, you know, if I'm sick or have the virus but don't seem sick yet, but I'm washing my hands, I'm not touching my face, well, this is all helping protect other people. But if you're positive with COVID-19, and, maybe you're handing me a glass or something like that, but I'm making sure that then I don't touch my face, or I'm making sure that I wash my hands after I've touched something before I touch my face, then I'm helping to protect myself from getting COVID-19. So it's often very similar actions on both sides that help stop the virus from getting into the environment. And then if the virus is in the environment, from it getting into you, because it's the same actions. It's what stops you from breathing it in or breathing it out, and what stops you from touching something and transferring it to your face. Those are the really simple things.
Yeah. Um, this information is really invaluable during this time. And I think sharing about masks, sharing about hand washing, sharing about where COVID-19 is found and how to get there really helps put it into perspective of how to keep people healthy. So it's awesome, Jeremy, to have you share this information um, with your expertise. Do you want to close us out with any last ideas or thoughts?
Certainly, thanks. This has been a lot of fun. It's great chatting with you, and it's such an important topic, because all of our actions can really make a huge difference in keeping ourselves safe and helping to protect other people, our friends, our family, our community. So it's all about individual action because it really does make a difference. And so the important thing to remember is that there are just a couple very key simple actions that help prevent you from transmitting COVID, but also help you from getting it. And so wear a face covering if you're out of the house. Don't touch your face if you're out of your house. Um, if you do touch any other surfaces while you're out, make sure that you wash your hands. And then just keep some distance between other people while you're out of your house. Because remember, I said that the virus is like this car driving off the cliff. You know, if you spend a little bit of distance between you and other people, then you're out of the danger zone. So all you have to do is keep that distance and wash your hands, wear the face mask, but make sure that it's covering your mouth and your nose. And you're going to be very effective at keeping yourself safe, but also keeping other people safe, because we're all in this together and our actions protect ourselves, but also others.
We are all in this together. Thank you so much, Jeremy. I can't wait until we can actually go to a bar. The first round is on me. And by that time, we'll have done everything we can in order to reduce the spread of COVID-19 and keep everyone healthy. So everyone be safe and see you all post-quarantine. And hope to see you soon, Jeremy.
Thank you. I look forward to it.
Awesome.
Everybody stay safe.